How much is your health worth to you? In other words, what's more valuable than your health? Your money, your home, your job, or your business? Most of us would emphatically say no. No money or job or material things are more important than my health. Right. But our collective behavior and health statistics paint another picture. Why is this conversation important to you? Your health highly corresponds to three important aspects of your life: your time, the value of your life, and the quality of your life. So your time is your longevity. This is the time you get to spend with loved ones and enjoy your life. According to a 34-year-old study published in July of 2018 by the American Heart Association, general healthy lifestyle choices can increase life expectancy up to 14 years. What does that mean? Imagine you're in your hospital bed, you're dying, you're gasping for your last breath, and someone runs in and says, "Hey, I can offer you 14 more years of life." What would that be worth to you? Secondly, your health highly corresponds to the quality of your life. A 2017 study conducted by the University of Chicago shows that as we grow old, one of our top fears is the fear of developing health problems and not being able to independently care for ourselves. This was high above the fear of death. And thirdly, it's important to us because our health highly corresponds to the value of life that we have, the value we bring to ourselves and the value we bring to others. We often hear that you can't put a static value on a human life. But in my experience, working with thousands of health seekers, those who have a critical condition, such as cancer, will spend almost any amount to recover their health when it's gone or when the threat of death is real. What's interesting is that the next third of students or clients fall into the category of chronic conditions such as diabetes or high blood pressure. They have different priorities. These individuals are willing to invest some time, some energy, and some money into their health, but often struggle with consistency, as most of us do. Today, our focus is not on the value of your health, as I think we can all agree that we value our lives, we value our health. But today we'll be looking at the how. We will discuss the three surprisingly simple pathways to increase the value of your life by enhancing our health and wellness. The three health pathways to health and wellness are to live what we know, to write our own owner's manual, and to periodically pull back and reassess. Why is this all important? And what does it mean to you? As we struggle to recover from the largest pandemic in over 100 years, in the aftermath of the SARS coronavirus 19, it has never been more clear to us that our lives matter. Our lives matter because it allows us to actualize our dreams and our desires. When we're children, we call these desires our dreams. Visualize a beautiful, bright child. She loves to dance and draw. She teaches herself to read at 3. This child is silly and giggly. Her favorite game is to line all her stuffed animals in a circle with her little brother and to play teacher. She would joyfully teach them for hours, to the irritation of her little brother. She grew up with 2 big dreams. One, to have a big family to care and love. And number 2, she wanted to be a teacher to help her students reach their dreams. Fast forward 40 years later, this successful corporate trainer and mother is in a completely debilitated state. She sleeps for nearly 20 hours a day. She doesn't work. She's unable to care for her small children. She has chronic pain and is extremely lethargic. Her once mild chronic digestive problems have worsened, and her health has plummeted to a critical state. At the lowest point of her health crisis, she is unable to enjoy the dream life that she created for herself. Sadly, that woman was me. The good news is that this was my path to pivot into wellness. Not only does ill health cost us our dreams, it also costs real money. What does it cost us? According to the data for the Center for Disease Control and Prevention, the CDC, 60% of all US adults have at least one chronic disease, and 40% of adults have 2 or more chronic diseases. Those chronic diseases are heart disease, cancer, lung disease, stroke, Alzheimer's, diabetes, and kidney disease. Please raise your hand if you've been impacted by someone in your life, a friend or a family member, someone in your community or workplace have been affected by any of these 7 chronic conditions. Virtually all of us. And adding up the total cost of lost productivity due to these chronic illnesses in 2016, it equaled nearly $4 trillion. Illness costs us a lot. Illnesses have become our new normal. For the first time in years, the lifespan of Americans have been shortened, meaning that many of our children won't even live as long as we do. Our new normal. Our new normal is chronic illness, obesity, depression, antidepressant meds, critical illness and hospitalization, stress and anti-stress medications, sleeplessness, and sleep medications. Surgeries are scheduled like routine oil changes. Many people have chronic pain and use pain medication. And before the COVID-19 pandemic, we were all well aware of the epidemic of addiction to opioids to manage chronic pain. Welcome to our new normal. I was a colicky baby. How many people know what I mean? That's the baby that cries all night and pukes over everything. I experienced stomach problems and I thought they were hereditary. I had them all my life. I missed hundreds of days of school, work, and practices due to my health over my lifetime. And although I've been to many doctors, at the height of my illness in 2010, I chose to see another doctor. This doctor was experiencing some of his own health challenges. He was highly stressed, overweight, and had a skin condition. But what was off-putting is after I described all my symptoms of poor digestion, bloating, violent diarrhea, and debilitating constipation, he had no idea what was wrong with me. I was a vegetarian for 20 years. I thought I had a good diet. I knew that this had to be food related, and so I subjected myself to a 300 needle allergy test. Absolutely nothing. So this doctor's plan was to give me a series of more tests. Swallowing barium, having a barium enema, upper and lower GI, liver scan, colonoscopy. I asked him what he was looking for, and he couldn't say. I decided that I could not subject myself to all these tests that require radiation and radioactive materials without any assurances or direction. I say this not to disparage the doctors because I love doctors. I've been to many doctors over the years, but I just never got any answers. I was beginning to realize that the fate of my health was in my hands. I was learning that I am the expert of me. And I had to start paying attention. After leaving the doctor's office, I stopped at a used bookstore. I was committed to getting answers. I found a book called The False Fat Diet by Dr. Haas. I'm not sure why I chose this book. It must have been pure intuition. I wasn't trying to lose weight. I was trying to get well. I didn't even consider myself fat at all. I was just black chick thick. I read the book in one day and immediately began to implement the principles of this elimination diet. I tested my body's reaction to the sensitive 7 foods listed in the book, which are corn, corn syrup, milk, eggs, peanuts, soy, and sugar. Since I didn't eat meat or seafood, this left me eating mostly fruits and vegetables. I definitely saw a distinct improvement in my symptoms and my energy levels. Now seeing that, I knew my condition was food related. I registered as a student for an award-winning wellness retreat at the Living Foods Institute. I drove my children to my mother's where they would be away from me for the first time in their lives. I told my husband I would not be cooking. I was bearing down into this intensive where I worked extensively with a coach to learn to prepare natural plant-based foods that did not contain any of the sensitive 7, meats, or any processed foods. In 10 days, I lost 15 pounds. And 90% of the symptoms that I struggled with for over 40 years went away. I was completely blown away that years of suffering were eliminated not by tests and medications, but by learning and applying new health practices. I continued strictly with what I learned for 4 months. I lost 60 pounds of weight. Actually, I lost 60 pounds of waste, which were causing me to have water retention, inflammation, pain, gas, and low energy. I no longer experienced any of those problems that I had grown used to. Have you ever had a problem in your life that you had for so long that you just got used to it? That was my experience. Since these symptoms started as an infant, I'm not sure whether I ever felt good my entire life. And from that point, I determined that I would use the rest of my life to tell everyone the good news. Simple lifestyle changes can radically change the trajectory of your health. Literally, your health is in your hands. Please, Jesus, let that